My name is Dr. John Wessling, and today I would like to talk to you about fibromyalgia. Fibromyalgia is a rather common and chronic disorder characterized by widespread muscle pain, fatigue, and multiple tender points. These tender points are at specific locations on our bodies. They're on our neck, our shoulders, our back, our hips, even on our upper and our lower extremities. In addition to pain and fatigue, people who have fibromyalgia may experience morning stiffness, headaches, insomnia, irritable bowel syndrome, numbness or tingling of the extremities, painful menstrual periods, restless leg syndrome, cognitive and memory problems, sometimes referred to as fibrofog. Between 80 and 90% of those diagnosed with fibromyalgia are women. Most fibromyalgia patients are diagnosed based on two criteria. First is a history of widespread pain lasting more than 3 months, and second, the presence of tender points. Pain is considered to be widespread when it affects all four quadrants of our body, not in just one area. That is, you have pain in both the right and the left sides, as well as above and below your waist, to be diagnosed with fibromyalgia. There are 18 different sites on our bodies that are designated as possible tender points. For someone to be diagnosed with fibromyalgia, a person must have 11 or more tender points. Now at this point, I would like to share with you some amazing information on the cause of fibromyalgia that you probably haven't heard of before. Fibromyalgia affects the muscles. That's true. But it is not a muscle problem. It is a nervous system problem. It's a neurological problem. In other words, it's a brain-based problem. Now, I'm not saying that it's all in your head, but I am saying that it possibly could originate in your head. So let me explain. There are three parts to our brainstem located right here. We have the upper and the middle and the lower brainstem. Normally, your brain fires impulses down to the lower two parts of the brainstem, and this slows down or inhibits or quiets down the upper brainstem. And this happens normally. With fibromyalgia, this does not happen. The lower part of the brainstem down here does not slow down the upper brainstem. In other words, at this point, the upper brainstem is hyperactive, it's too excitable, it's too irritable, which will cause havoc in your body. So, what kind of havoc will this produce? Well, for one, it can cause insomnia or difficulty sleeping, which is one of those problems that fibromyalgia patients quite often have. Another is your headaches. And the reason for your headaches is because this upper brainstem is overfiring or hyperactive due to the fact that the brain is not firing impulses to the lower brainstem, down in through here. And the lower brainstem is not inhibiting or slowing down the upper brainstem. This area of the brainstem also has connections down into the abdominal area, in other words, down here into the intestines. And when it is hyperactive, then you have irritable bowel syndrome, which is characterized by episodes of diarrhea and constipation, abdominal pain, nausea, and even vomiting. Due to the overstimulation of the upper brainstem, this will cause you to experience an increased heart rate, maybe an irregular heartbeat, or even both of these at the same time. An overactive upper brainstem can overload your adrenal glands. Now, your adrenal glands sit right above your kidneys, and they can secrete chemicals into your bloodstream that causes pain. And when these chemicals are released into the bloodstream, they stimulate pain fibers, specifically type C pain fibers, which are the smallest and the most painful pain fibers. When this occurs, the fibromyalgia patient may have headaches one day, they may have knee or leg pain the next day, they may have back pain the day after that, and then they may have pain in their arms and their shoulders. In other words, they have all these different types of pain. It also may make your adrenals secrete too much cortisol. Now, cortisol is a hormone, and cortisol in areas of the brain can really create that fibro fog, that difficulty in finding the right words to say and then being able to enunciate your words clearly. So what causes your brain to not send the impulses down to your lower brainstem that'll slow down your upper brainstem? Well, in a nutshell, stress. Stress in the form of physical, environmental, and chemical stress. Physical stress could come about because of a car accident, or falls, or bumps, or bruises. Emotional stress could be due to a financial difficulty, a divorce, abuse, or even difficulties at work. Chemical stress from hormonal or metabolic imbalances, or even side effects to certain medications, or maybe even junk food. Now, do any of these ring a bell? Think back for a minute and see how many of these stressors that you have had or do have in your life. All of these severe stresses on your body cause your brain or your lower brainstem to misfire, causing all of these symptoms that I've talked about. Okay, so what do we do to fix it? What makes us any different from all the other doctors that you've seen? Well, we treat fibromyalgia from a neurological and metabolic perspective. In other words, we do a functional neurological exam to check your brain and your nervous system that may contribute to your pain, fatigue, insomnia, and brain fog. And then we do clinical tests, including urine and saliva, blood chemistry, and really evaluate everything to see if there's any hormonal or metabolic imbalances. So often, there are chemical and inflammatory causes of fibromyalgia. We leave no stone unturned in devising a natural approach to work on the source of your inflammation and your pain. The clinical tests, laboratory testing, including the urine and saliva that we do, is done to determine your underlying metabolic state, which may be the integral key in your recovery. Our purpose is to stay focused on how well your body functions, and if it is not, we do our exams and testing to get to the root of the problem. The only approach that makes sense, that has a chance at making a real change in treating fibromyalgia, is to look at everything all at once. And in so doing, it then becomes clear that everything is not normal, as is so commonly perpetuated by doctors that prescribe medications for such a complex problem, and who are unwilling to take a deeper look at function. The key to successfully treating fibromyalgia is to restore function to your body in the form of therapy, to your brain and nervous system, and by correcting the metabolic imbalances. Patients who had fibromyalgia once thought they were going to be debilitated and were going to have to live the rest of their lives on the sidelines. And now they have been able to get their lives back. But it was only possible because the right evaluation and treatments were done. If you suffer with fibromyalgia and would like to learn more about our fibromyalgia treatment program, you may request a free report by filling out the information below, or you may schedule an appointment by calling our office at 316-262-3931.